Hey, welcome to The Explainer. Today, we're diving deep into digital mental health. It's this whole industry that promises to revolutionize care with just a tap on your phone. But, well, the reality, it's way, way more complicated. So let's break it all down.
Okay, so let's just start with this big, central question. Why isn't your therapist an app? I mean, think about it. We do everything on our phones, right? Banking, ordering food, dating. It seems totally obvious that mental health care would be the next big thing. But it's not. Not really. And we're going to figure out why.
All right, to really get a handle on the problem, we've got to talk about the promise first. Because, on the surface, technology looks like the perfect answer, the silver bullet for our growing mental health crisis.
And honestly, the vision is so powerful. You think about traditional care, right? You've got to physically go to an office, it's super expensive, there are crazy long wait lists. And then you have the digital promise. Care anywhere you are, way more affordable. You can get it on demand. And it's private, which helps with that all stigma thing. It sounds amazing.
I mean, it sounds like a total no-brainer, doesn't it? So if the promise is that good, why isn't it working? Why are we still struggling so much? And that, right there, is where we enter the implementation maze. The idea is simple. The reality, not so much.
Okay, so here's the absolute key takeaway from a ton of research. The problem isn't the technology. Seriously, we have some incredible apps and platforms out there. The real problem, the place where this all falls apart, is in the implementation. It's how we're trying to jam this new tech into our old, incredibly complicated healthcare system.
And listen, this isn't just a theory or a hunch. This is backed by some serious, rigorous research. To get to the bottom of this, researchers sifted through literally thousands of studies. They narrowed it all down to pinpoint exactly what's going on, and what they found was this huge, interconnected web of issues. And what they discovered is that these barriers, these roadblocks, they're not just in one spot. Nope, they exist on 4 completely different levels. The best way to think about it is like an onion. You've got the patient at the core, then the provider, then the organization they work for, and on the very outside, you have the entire system. All the policies and government rules. You've got to peel back every single one of those layers to really get it.
Okay, so let's start peeling. We'll begin with that first layer, the most personal one, the human hurdles. We're talking about the real-world, day-to-day experience for both patients and their providers.
On the patient side, a lot of it just comes down to a bad user experience. So many of these tools are designed as a one-size-fits-all solution. And you know what that means, right? It means they don't really fit anyone all that well. They often don't account for different cultures, genders, or the specific needs of groups like the LGBTQ+ community or indigenous users. And when the content is just bland or repetitive, guess what happens? People just get tired of it and stop using the app. There's even a name for it, user fatigue.
And believe me, it's just as frustrating for the providers. I mean, imagine being handed some new piece of tech that's clunky, complicated, and doesn't mesh with how you already do your job. It's not a help, it's just an extra burden. Instead of saving time, it actually creates more work. Plus, a lot of clinicians say it's just plain harder to read a patient's cues and build that essential human connection through a screen.
This quote from the research really just hits the nail on the head. It's not that providers are anti-tech, not at all. It's that there's this huge fundamental disconnect between the digital tools they're being given and the actual day-to-day practice and values of providing good mental health care. So, all these struggles we've been talking about with patients and providers, they're really just symptoms of much deeper cracks in the foundation. So now we're going to zoom out and look at those next layers of the onion, the system's fault lines. These are the big organizational and policy problems that basically set everyone up to fail from the start.
Okay, this right here shows a huge problem that goes way back. Years ago, the government passed something called the High-Tech Act. It poured billions of dollars into helping hospitals and doctors' offices go digital with electronic health records. But look who got left out. Almost the entire behavioral health field. Psychologists, social workers, community mental health centers. Nope, not for them. This created a massive digital divide from the get-go, and it's all part of this long, frustrating history of treating mental health like it's totally separate from physical health.
And then you add in this ridiculously tangled web of privacy rules. Now, don't get me wrong. Rules like HIPAA are super important for protecting our data, but they are so complex, and sometimes they even contradict each other, that it's created this culture of fear. Providers are so terrified of accidentally breaking a rule and facing huge fines that they just don't share information, even when sharing it is perfectly legal and could dramatically improve a patient's care.
And this leads to a wild paradox.
The government actually has rules against something called information blocking, deliberately withholding patient data. But the privacy laws are so confusing that they lead to the exact same outcome. Providers play it safe, they don't share, and critical health information ends up stuck in these isolated silos. And here's the final kicker. Even when a mental health provider does manage to get an electronic record system, a lot of the time it can't talk to the system at the local hospital or your family doctor. It's like trying to open a Mac file on a Windows PC from 1995. It just doesn't work. And this lack of interoperability, that's the technical term, it creates completely fragmented care where nobody has the full picture of a patient's health. Phew. Okay. So yeah, the problems are deep, they're systemic, it's a lot. But here's the good news. The research doesn't just stop there and say, well, good luck with that. No, it actually gives us a really clear evidence-based blueprint for how to fix this.
It boils down to a pretty straightforward 4-step plan. Number 1, you have to co-design the technology with the people who are actually going to use it, the patients and clinicians. Number 2, you've got to train the workforce so they feel confident and comfortable with these new tools. 3, you have to align the money, the financial incentives, so that it actually makes sense for organizations to adopt this stuff. And finally, number 4, we have to clarify the rules around data sharing to get rid of all that fear and confusion. A massive piece of this is just building trust. The experts and the research said one of the most powerful things you can do is just share success stories. When providers hear from other providers about how this technology actually helped them and their patients, it starts to break down those cultural barriers and that fear of the unknown. So if there's one thing to take away from all of this, it's this. We need a systems approach. It's the only way this works. Technology by itself isn't some magic bullet. It has to be patient-centered, the policies and the money have to be there to support it, and education is just absolutely key to getting past the fear. Because at the end of the day, you can have the slickest, most beautiful app in the world, but it can't fix a broken system.
Look, the potential here is it's incredible. Technology really can open brand new doors for mental health care. It can make it more accessible, more effective, better than it's ever been. But after digging into all this, the real question isn't about the tech. The question is for us. Are we, all of us, ready to do the hard work of actually building the system that lets people walk through those doors?